I have two bill introductions. The first is RS 2745, and that is in regards to the summer EBT program that the federal government just created, and this bill would instruct DCF to not participate in that program. $27.45. Yes, 2745 RS number. The next one is RS 2856. RS 2856. This bill would request DCF to submit a waiver to the federal government to allow Kansas to ban soda pop, soft drinks, and candy from being purchased with EBT cards, so the SNAP food assistance. Currently, the federal government has not granted states waivers on this, even though several states have requested. And so the intention of the bill is to have DCF submit the request for a waiver from the federal government so we can not allow soda pop and candy to be purchased with food assistance cards, and to continue submitting those waivers each year until the federal government grants the request. That was 2856. Representative Roth.
Chairman, does that include the energy drinks that are out there as well?
Can I punt that to the revisers? Jesse, any thoughts on the energy drinks? Okay, so it is something that could include, but I think on initial draft, it would not be included.
The reason I ask is I've had constituents that own convenience stores ask me if there was a way that the energy drinks could be prohibited from minors from buying. And so I've got I've got some medical data on that and stuff like that of the effect of that's why I was asking. Thank you.
Committee, any questions on the bills? Any objections? That the request is allowed. The request for introductions are allowed. So with that, we're going to go ahead and jump right into the presentation, the video, and then we'll move to question and answers. I guess first, I'd like to welcome Mary Throw, Chair and CEO of the Independent Institute, to committee. And Mary, if you're here, be great. Yeah, there you are. Would you like to give a brief introduction, Mary, for yourself and also for your video? And after that, if the time is appropriate, we'll go ahead and move straight to the video. So welcome, Mary.
Thank you. Thank you for inviting me, and thank you for taking the time to screen our documentary, which is rooted in our peer-reviewed policy report on homelessness and housing with the same name, Beyond Homeless. This came out of, I'm a native of Wichita. I've been living in the San Francisco Bay Area for quite a while, and I've also served on the Salvation Army boards both locally and nationally. So this is an issue that's been very much in front of me, and very perplexing to see it continue to grow despite here in California literally billions of dollars being thrown at it, and across the country as well. So we started looking into it. This is really a story. It follows my looking into why homelessness is so terrible, specifically here in San Francisco, but the reasons here are pretty universal. And then looking for solutions, and did find a very community-wide solution. So the name is Beyond Homeless, Finding Hope, because we do think that there is hope for this issue. It's complicated. It's not a one-size-fits-all solution, but we very much appreciate your considering it, and I'm happy to answer questions following.
right, well, thank you, Mary. Are we ready on the video? And just, yeah, we'll go ahead and watch the video then. And then afterwards, move to question and answer. So I think it's about a 45-minute video, right around there. I don't foresee any reason to stop, but if there is, please let me know. But we'll go ahead and start. Thank you.
Doing with all this money that has been allotted to the city, where's that going?
There isn't enough drug treatment for everybody in this.
Is doing anything transformational, trying to help these people lead an independent life.
You cannot arrest this issue away. You cannot arrest homelessness away.
We have pitted the smallest differences against each other.
People don't just disappear. We need actual, real alternatives.
We're throwing vast resources at this issue, and it just keeps going up. Really? We can't come up with anything better than that? California really was the Golden State when I arrived in the 70s. Everything seemed possible. There was so much optimism. I arrived as a young college dropout, eventually earned an economics degree at Stanford, then ran a pioneering all-delivery market called the San Francisco Grocery Express. These days, my beloved San Francisco has become known as ground zero for our nation's homelessness crisis. But the reality is far worse than it sounds. An exploding population of unsheltered in the street serves as constant reminder that the current approach isn't working. The more I looked into the issue, the less sense it made. Homelessness is decreasing across the country, but in San Francisco, between 2017 and 2019, it increased 31% to just under 10,000. And it continues to rise while city and state spending to, quote, end homelessness continues to grow. Something doesn't add up. In this film, we're going to explore what's driving the homelessness crisis here in California. We're also going to look at alternative approaches that offer hope for a real solution by treating the root causes of homelessness. Even though I work in policy and am used to talking about issues in terms of numbers and percentages, homelessness is different. Every number is an individual with a unique story. A husband, wife, father, mother, son, daughter, friend or family member, all deserving of human dignity. It's nothing less than a humanitarian crisis, and a solution to the homeless crisis has been eluding us in San Francisco for way too long now.
So each successive mayor comes up with their own, quote, plan.
1,000 units right here in the Tenderloin,
which recognizes that shelter alone won't answer homelessness needs.
My homeless program is one that is sensitive, it's caring, but it's also no nonsense.
We have shelter space, we have drug treatment on demand.
It's about getting out of the shelter business to the extent we can.
Some advocates say things are worse now for the homeless than ever.
San Francisco, like many cities, is in a terrible state. There are tents everywhere. There are people lying in the street that are harming themselves, and they're not getting better. They're not getting the help they need. We don't need to have our fellow citizens dying on the streets. In San Francisco, you can just look at the news. You see people being accosted on the street, stories about teams just to clean up feces, stories about individuals and crime increasing, tourism falling off. It is a crisis, and whether you're concerned about the individuals that are experiencing homelessness, which is the biggest concern, or the businesses or the tourism or anything else, or the quality of life for people living there, it's a problem all the way around, and it's getting worse, not better.
I started by talking with those with experience living on the streets. 3 years ago, Tom Wolf was homeless in the Tenderloin district.
I was just sleeping on a piece of cardboard on the street. I had 2 jackets, double pair of jeans on, stay warm, and a hoodie. I was married, I have 2 kids, a homeowner. I worked for the city and county of San Francisco. I had surgery on my foot. I was prescribed oxycodone. And then I went from there, I tried to get a refill, I couldn't. So I actually looked up on YouTube, and sure enough, I found like 6 people that were selling oxycodone, variants of opioids. And then my addiction grew over time. This has become kind of a regional magnet for homelessness and addiction because of those drug dealers we saw across the street.
So what happens to them?
Well, 700 of them die a year. That's one thing that happens to them. And if it doesn't get them this year, it'll get them the next year.
Here in liberal progressive San Francisco, we have the most anti-homeless laws out of any city in California. And so what that means is that if you're not able to get into a shelter, your mere existence is criminalized. Someone will call and complain, and they'll go out and move people along. But the problem is, people don't just disappear. We need actual, real alternatives. It's not as simple that, well, why don't they just stay in a shelter? It doesn't exist.
Disabled firefighter Cooper Arona has chosen to turn her experience to helping those around her as a street medic. Due to her training and refusal to look away from people in need, she's well acquainted with the cycle of trauma that's occurring on the streets.
It was a very busy morning this morning. Some folks needed medical assistance. One person had to be Narcaned. I am a disabled firefighter. When I couldn't work anymore, I didn't know what to do, I went through a divorce and ended up out here on the streets. And in that time frame, I was staying at the 24-hour women's drop-in. And so just seeing the aches and pains and the woes that were happening around me, I started, fixing people that needed it, and they needed it badly. There's a lot of trauma, and there is a lot of things that happen that people never got the right amount of counseling and or support for. And so people out here are lost in a lot of ways. They've continued to lose themselves because they don't have the skills or the wherewithal to know that that's what they're running from.
I mean, is it just that there's so much suffering that the city departments can't do it all? Or?
If you understood what's going on, you see what's happening in front of your own doors. People are suffering, people are hungry, they're without shelter. What are you doing with all this money that has been allotted to the city? Where's that going?
Tonight, we follow the hundreds of millions of dollars that are spent every year to try to fix the problem. It has some people wondering, where's all that money going?
In the 2019-2020 fiscal year, it was estimated that city, state, and federal funding, combined with private sector donations, added up to $1 billion of homelessness spending. It begs the question of how well these funds are being used, especially if it's not visible on the ground. The current model of addressing homelessness that federal, state, and local government has been committed to is called Housing First. The Housing First model prioritizes immediate housing with the intention to follow up with supportive services. The problem is that the supportive services are being shortchanged by the costs and complications of housing, which leaves the underlying issues of homelessness unaddressed. And without the follow-up of support, many end up returning to homelessness. An added complication in San Francisco is that Housing First often consists of single-room occupancy hotels, or during COVID, actual commercial hotels, mixing populations of those trying to establish transformed lives with those with continuing addictions and mental health issues.
If you don't have housing capacity and you don't have supportive services, you can't do Housing First effectively, period. So I think we get caught in this argument about, is it a good philosophy, bad philosophy? It's a great philosophy. We don't have the resources to do it right, so that's why it's failing miserably. And I believe that that's been a large contributor to the huge number and growing number of unsheltered people across the United States.
Housing solves homelessness. It's demonstrably false. And the reason that it's demonstrably false is that when you look at the numbers of unhoused people living on the streets and you understand the significant illnesses and behavioral challenges that they have, it doesn't matter what the approach is, low barrier, Housing First, whatever. What matters is helping people suffering on the street versus how do we get people into housing that we've just created with these federal programs. But because it's so expensive, because it's so costly in terms of time and in terms of regulatory, we're trying to empty the ocean with a paper cup when it comes to a Housing First approach.
When it costs $500,000, $600,000, $700,000 to build an affordable housing unit, we simply can't build enough to house everyone experiencing homelessness. You know, for every one person we get off the street, there may be 2 or 3 others that end up on the streets, and so we keep falling farther behind.
Jennifer, we've been trying to figure out why housing is so expensive in California. Can you enlighten us?
The fact is, growing up in a town like Pittsburgh, California, the 3-bedroom, 1.5 bath home that I grew up in costs the same amount to build in California as it does in Nevada or Arizona. But in California, we've taken a whole bunch of steps to make housing super more expensive through policy and policy as articulated by law and judicial decisions. There's almost no development that anyone has a legal right to do in California when it's all said and done. The real question is, does anyone with money or political influence want to stop housing? That is the legal question. And if the answer to that question is yes, then it turns out you don't have the right to build anything. You have the right to hire a lawyer to enforce the law, and after a period of years, you may or may not enforce that right. Some of these are zoning level local policies, long used to discourage low-income housing, minority housing, such as prohibitions on apartments or very high-cost fees for development impacts. Others, and those that I focused on a good bit, include our increasingly fussy definition of the environment as what each of us experiences when we look out our bedroom window or jump in the car on the curb and drive to the grocery store. As we've personalized the environment, we've gotten able to use environmental law against changes that we don't like. I don't want to see a different view out my bedroom window. I'm going to now challenge the house that would go in the next door lot.
In 2019, there was a White House Council of Economic Advisors report that came out looking at the problem of homelessness. And in particular, one of the things they looked at was the amount of housing regulations that government imposed and how that affects homelessness. And what they found was that simply by deregulating these housing policies, getting rid of these government restrictions that prevent housing from being built and limit the supply of housing, you could have substantial reductions in homelessness. In fact, they said in San Francisco by as much as 54%.
The effect of adopting the Housing First model as a one-size-fits-all solution for California is that the majority of funding gets usurped by its inflated cost of housing. This leaves very little behind for services like health, temporary shelter, and outreach. And to make matters worse, the top-down dictate by government agencies has effectively made it impossible for programs with recovery approaches to compete for funding.
I have seen the impact that the Department of Housing and Urban Development's over-reliance on the Housing First model has had in terms of diminishing the opportunity of creative solutions outside of the Housing First model.
So a lot of people I've been talking with over the course of the past couple of weeks term homelessness is a housing problem.
Right. Of course, there are housing elements. And if you call something homelessness, and of course you give somebody a home, problem solved, right? Well, I wish we would stop calling this homelessness and really start calling it what it is, which is open-air asylum, shooting galleries, and the same. Just think about dementia. You wouldn't leave a dementia patient running around on the street. You wouldn't do it. But we do it with people with these other brain disorders. And if you're a drug addict, this is the thing that people miss about drug addiction. Drug addiction is a progressive disorder that ends in death, particularly opiates and meth, which is what we're dealing with on the streets. So leaving people untreated is murder, in my humble opinion. It's committing them to die. It's where the disease goes. It goes to demise.
For decades, the Tenderloin District in San Francisco has been accepted as the neighborhood where homelessness, drug use, and the sex trade were generally left alone. Unfortunately, it's also home to the largest concentration of children in the city, with poor families crowded into tiny apartments. I've spent a lot of time there over the years as a volunteer. So I was shocked on my recent tour with Tom Wolfe to see just how bad it's gotten, with blocks-long open drug dealing and use, third-world filth, and scores of people in various stages of consciousness. Special public sanitary initiatives have been developed solely to address the extraordinary conditions there. They collect hundreds of thousands of needles yearly, and now have special crews that deal with human feces cleanup.
Is this the worst you've seen it?
There's more feces on the sidewalks than I've ever seen, for sure.
Mayor Mark Farrell announced today there are so many needles and syringes on the streets here that he'll hire 10 people whose sole job will be to pick them up.
I used to literally sleep in this doorway right here. I had a piece of cardboard. I would kind of squat and just sit down with my back up against the wall of this door. Or sometimes that doorway over there. If you come here at night, if you come here at 10 o'clock at night, there's probably 30 people out here just using, right? And the drug dealers will be across the street all the way down. And, you know, there's a combination of tension because there's so many drug dealers, they're competing with each other. There's tension because the addiction runs really, really deep with people here on this street, right? On this block, in this neighborhood. When you're struggling with addiction, many times, you know, people have already been through the system, so they're resistant to services because they're also afraid to give up their drugs. So you're stuck in this vicious circle of saying no to outreach and at the same time doing what you need to do to maintain your drug addiction, which is stealing, shoplifting, holding drugs for the dealers like I did, sex work, a variety of different things.
My patients love their drugs so much. I've had people tell me that they had a gun in their mouth, they were so desperate, they were going to kill themselves, but they thought to themselves, oh, I can't leave my drugs. I love them too much. Addiction is a motivational disturbance that it takes over the basic survival system of the brain and says, use drugs above everything else. Don't care about your family, don't care about your job, don't care about your very survival because the drugs are more important.
The lack of supportive services like drug treatment facilities is taking its toll on the sheltered and unsheltered alike. In 2020, 712 people died of overdoses in San Francisco, almost triple the number of deaths from COVID. But 2/3 of them were housed, so clearly housing isn't solving the problem.
There isn't enough drug treatment for everybody in this city. The Department of Public Health only has access to like 35 detox beds for a population of 800,000 people, of which at least 25,000 are struggling with drug addiction.
It's really hard. We were walking around today. You glance up an alley, there's a young man. Maybe he's dead. Maybe he's just passed out. This is the richest city in the country, probably. We're 30 miles from Silicon Valley, where innovation is happening, where new solutions to the 21st century problems are being created. You know, we're working on going to Mars. Behind those tarps are tents that the city calls a safe sleeping site that the city's maintaining. So it's tents with bathroom facilities, with a gigantic sharps container and so on. And it's $61,000 for every tent in there. Okay, so you spend $61,000 to maintain somebody in a tent with their problems. Really? We can't come up with anything better than that?
What we're seeing now is the government and the folks who are working in City Hall really at odds when it comes to this crisis. We are unfortunately governing and legislating on the extremes, where we have pitted the smallest differences against each other.
When you get government funding, there's strings attached. That's just how the game is. So if they stand up and speak out and say, no, this is wrong, it's a very real reality that they could lose their funding.
If we look at the first couple months of 2021, we have already seen 135 deaths by way of overdose here in the city and county of San Francisco. So that number alone proves that there is a real disconnect between homeless individuals, their outcomes, and the policies and programs that are coming out of City Hall here in San Francisco.
Great big headlines in the Chronicle this week about the mayor unveiling the boldest housing project in 25 years or something. She's going to give out 1,100 housing vouchers and then build 1,500 new housing units. No.
Because I haven't read the headline and whatnot, but if you're telling me this, my mind goes to automatic doubt. Because if like I had mentioned prior, that if it was that easy, why we have already been doing this? Why are we now? You're making this big grandiose thing, should already be done. But I don't see it. It takes too long for that to happen. It's like crickets, like crickets. That's all you hear is nothing when it comes. That's what I hear when the city's involved and the city entities are involved in something like this. It's crickets.
So what do we do? Is it hopeless as so many think, or are there solutions? I looked around the country and visited several effective programs, but San Antonio stood out with its community-wide solution that has solved the issue at scale.
It's called Haven for Hope, and while San Antonio has shelters in the city for homeless people to stay in, this place is far from a shelter. Just check it out. It looks more like a college campus. There are places for people to stay and resources to help the homeless, but Haven for Hope goes above and beyond what you'd see at a typical shelter, with a place for kids to play and learn, a kennel for people to keep their pets, a gym, and so much more.
I never paid much attention to the homeless. It was not overpowering in our city. But for whatever reason, it began to increase in those years right before I was the mayor. And by the time I got to be mayor, there was quite a bit of visible homelessness. And so I decided when I made that State of the City address, which was in January, I would not only do the customary thing of bragging about your city and how well you were doing, but I also wanted to show the other side of the city and eventually challenge the businessmen in the room to help me do something about it.
And here's my request to you, the people in this room. Give me the help you gave me when you so magnificently rose to the challenge with the evacuees. If you do so, we shall solve the homeless problem in San Antonio.
I knew nothing about the homeless problem. And as I'm watching this program, what comes to light is that we have all of these problems and nobody is addressing the root cause of what's causing these problems, and nobody is doing anything transformational trying to help these people lead an independent life. And so I talked to the mayor the next day and I told him I saw this program. And I said, we're failing the homeless people here in San Antonio.
He had not supported me in the election, by the way. And there was kind of a rawness in our relationships. Big gruff voice, he said, Mayor, are you really serious about doing something for the homeless? And I said, I'm completely serious about it. And he said, well, I want to help. And I said, you just became the chairman of the committee if you'll accept it. He says, I accept it. And that was the beginning of our little war on the homeless in San Antonio.
Could you see a 24/7 shelter in the city of San Antonio?
Yes. Yes, I could. I think it ought to be a part of the structure of the city.
All the stars were aligned. I had been involved in the community in a meaningful way, both financially, giving of my time. So it was easy to ask people for money where they had been asking me for money. We then talked to the county judge and he said, I'm going to support you. So I had the city and the county supporting. And then we identified all the nonprofits in San Antonio that deal with the homeless one way or the other. No one wanted to relinquish what they were doing to Haven for Hope. And we said, that's not it. This is going to be 1 and 1 is 3. So we had to really convince people to become part of the mission.
It was more than just giving them a bed for the night and a meal and a shower. So the idea, okay, let's try to see how many of these people we can save.
Good morning.
Good morning. How you doing?
Good. I'm Mary.
Mary, I'm Pete. It's a pleasure to meet you.
Good to meet you.
I'm glad you could join us this morning. We're going to speak to a gentleman, James. and see if we can give them some services. I've already been engaging with them for the last 2 weeks.
How long have you been out here?
Oh, about 10 years maybe.
Yeah.
Till my divorce, and then when she left, took my kids, kind of.
It's a tough battle for James. James is also battling, if you don't mind me sharing, James, all right, with the substance problem, like I've told you. And then I ran across him one day panhandling, and we engaged, we talked, and we struck a pretty good rapport. So he requested from me if I could help him get into methadone so he could stop using heroin, and he wants treatment as well. So we've had conversation, and he's very determined. He's got his mind straight right now, and he wants to get off the street, and he wants to stop using drugs.
You got things to live for.
The Haven for Hope campus in the center of San Antonio can serve up to 1,700 people at a time and works with 184 partners, 70 of whom offer on-site services. This collaboration creates the kind of support that can meet the individual needs of every person who walks onto campus. Whether they just want to escape the streets for a night in their courtyard, or they want the long-term transformational support of full recovery. The impact on the city has been tremendous. Unsheltered downtown homelessness has gone down by 80%, along with substantial savings within emergency medical services, hospital care, and the police department. Since opening in 2010, they've helped almost 6,000 people through their transformational program and into permanent housing.
I remember coming here with only 2 bags, and I remember walking through the gates. Just like now, I was choked up. There's a different vibe here. You walk through those gates and you see something different than you see it, what your typical homeless shelter looks like. It was vibrant, it was colorful, it was bustling. There were people smiling back at you. I experienced a lot of hope coming onto the campus. People displayed an eagerness to help without delay, and I had not experienced that before. I knew deep down inside that I would gain the tools and the resources and the support to move forward. I just instinctively knew it was different, and this was it. It was, for me, similar to hitting the lottery.
It's priceless to be touched. It is. You know, believe it or not, it can wake a person up. Just to pat them on the back. It's hard.
Say that. I knew you would be.
I would tell you as much as I knew about him, but I couldn't tell you in front of you.
But that's okay. That's okay. You know, because we all need a second chance, you know?
Right.
Yeah.
We're doing that.
Yes, I see it.
Right.
Justice involvement is over.
Right. Yeah, all my court cases have been dropped.
Good. That's amazing.
That right there, you know, if it was nothing else, this has been good enough for that. That part right there.
You're doing great. You're putting in all the work, so now you're seeing the results, right?
So far, so good.
Yeah.
You've got PD on the front lines, EMS, hospital systems, the mental health systems, behavioral health systems. All of these systems were working in silos and not working collectively together to have that impact. So in San Antonio, we were able to, over time, bring these systems together to all row in the same direction instead of each doing their own thing. And I think many communities across the United States could really benefit from looking at the issue of homelessness through a more systemic lens.
You cannot arrest this issue away. You cannot arrest homelessness away. You cannot arrest addiction away, and you cannot arrest mental illness away. This is why Haven is here, is to address those issues. These officers that we hired work this area already. They know our clients know them. These officers are extremely knowledgeable, extremely compassionate, and understanding of the needs and the issues that our clients go through every single day with respect to mental illness, with respect to addiction issues. And this is why we hire these officers, because they are acutely aware of the issues that our clients face every single day.
But once we started working here and started meeting all the different people, now we go out there and somebody, we can tell when they're having a bad day, whether it's off meds, a manic day. We know to talk to them now, to try to bring them down. We don't just throw handcuffs on them, bring them to jail, throw them in jail. What we have to do is bring them to the hospital. We try to talk to them, get them to calm down. And that's something I've learned. I can tell you, the other officers who work here will tell you the same thing. We learned that by working here with the people.
It's 22 acres, 17 buildings, 300 staff members, 184 partners. But here's what we do. We help individuals find out what happened, say, here are the services we have to help you get to a better place, and that's what we do. And every person we serve is different from each other. Every staff member we have is different from each other. So we're not here to remake anyone, including our staff. We're here to find out what happened. Not what's wrong with them, but what happened to them. And we have every tool imaginable here for them to be helped to get to a better place. And it's happened thousands of times. This works.
I think the community has a compassionate side. Maybe everybody has one, I don't know. I know San Antonio has a compassionate side, and it's at every level. You just have to tap into it.
And the key is having the right culture in running that kind of an organization. Culture is so important. And the culture that Haven for Hope has is love. When these people come to campus, it's unconditional love.
You know, there's a saying, wherever you go, there you are. And homelessness is an inside job. And I wasn't addressing the circumstances going on in here. So, you know, I became my greatest challenge. Until I addressed those matters is when I began to establish having a home for myself. One of the most valuable tools I have today is seeking to understand, where did you come from? How did you get here? How can I support you? My question is, how can I serve you? What can I do to help you get from here to there? And that's a spirit on this campus.
My visit to San Antonio really opened my eyes. Haven for Hope's transformational system was meeting the complex needs of the unhoused with the spirit of compassion. It is the product of the whole community's coming together that is functional at every level, and the pride feeds back into the whole community.
It's interesting. It's such a complex issue, so it's nice to see something that seems to be working in San Antonio there.
Absolutely.
All right, thanks, Molly. Appreciate it.
In 2010, when Haven opened, the city of San Antonio's homeless numbers were similar to San Francisco's. Yet while Haven has resulted in San Antonio's homeless population declining, San Francisco's has exploded. Clearly, we need a new approach. The good news is we have people who care. We have really smart innovators, and we also have the financial capacity in the private sector.
When you look at the programs around the country that are invested in not just the provision of housing, but in actually improving people's lives, you see this very, very different view of how to solve homelessness. And I think we need more of that.
In most industries, the way you fund big solutions is you create a strategy and then a plan and then a budget behind that plan, and you go out and you sell that to investors. If you wanted to create a large real estate complex, you would do it that way. In homelessness, for some reason, we want to raise money, and then we want to say, we're going to go create a plan. And without a big comprehensive plan, complete with addresses and buildings and programs that match the target market that has the needs, you're never going to get the private sector support, either with dollars or community support.
In 2018, Gabriel Baldinucci and his organization, the Urban Vision Alliance, began meetings with representatives of sectors across San Francisco to help design a system-wide homelessness solution. A system that attracts the private sector into expanding capacity, fundraising, and program development that works to move people through homelessness into long-term stability. Their first step was to partner with the Salvation Army, who owns several large properties in San Francisco, and to redevelop 6 of their existing sites to launch their Way Out initiative that will include housing with wraparound services, including recovery, workforce development, and other services, much like Haven for Hope.
So we've got our flagship Harbor Light facility, administrative and residence hall here. There's a statistic out of LA as we look at our ARC program and our Harbor Light program that says people who complete a program for 6 months only have a likelihood of 10% chance of continuing to live a life of sobriety. When you wrap them with support, like life skills training, like workforce development for 2 to 3 years, we've seen that same number jump up to 90%. So we are trying to introduce this concept to the city that will allow them to think a little differently, to really have a different approach, because we've understood over the past couple of years that different people need different solutions.
What's it going to take to realize this vision in San Francisco from a political point of view?
I believe it'll take a combination of things. First, I think you're starting to get a lot of support from case studies around the country of approaches that are working. I think that it's going to be us winning over people one by one to understanding the logic and seeing this solution. And it's also going to take progress that we make with the Salvation Army in adding those beds and developing those effective programs that we see in other parts of the country and bringing them to San Francisco. So I don't think it's going to happen overnight, unfortunately, but we're going to continue to trudge forward and try to win people over one by one and win credibility through progress.
San Francisco prides itself on being a leader in progress, but lately it hasn't worked that way. In our visit to San Antonio, we heard about people coming together across political divides to work together in community to successfully address their homelessness crisis. Here in San Francisco, the people we talked with have described a city that desperately needs to collaborate better. While city, county, public, and nonprofit providers are partnering more here recently, we're still a long way from the kind of cooperation that it took for San Antonio to conceive Haven for Hope. Although more funding initiatives are underway, we know from experience that spending alone is not a solution. We need to inspire community-wide collaboration, such as Urban Vision Alliance's coalition of 32 organizations with the Salvation Army to help reverse this human tragedy. The only question is, who will be our Bill Greehey, who can push citywide political will behind a holistic, community-wide approach? Whichever approach we pursue, we need to keep top of mind that homelessness is a human problem, and our solutions need to meet the complex needs of the individual rather than trying to devise a one-size-fits-all solution that fits the needs of our institutions. Ultimately, this problem is an opportunity to affirm the infinite value of each individual and to establish new and healthy ways of working together in community to solve challenges. Learn more about the complexities of homelessness in the U.S. and the inspiring innovation of communities who are meeting its demands at beyondhomeless.org.
Thank you, Mary. Welcome back. Just real quick, committee, little quick side tangent comment. Yes, this is a video about San Francisco, California, San Antonio. We will be hearing from organizations in Kansas over the next few weeks, for sure, that work with the homeless. But I think it's very important for us to keep an eye on the big picture as well. There's a lot we can learn from those individuals who work on this topic on a national level and from others, especially cities and counties and states, on their efforts. So that's the intention here, is to learn from people who know about this issue because of their work over many decades. And so that's where we're very grateful. I'm very grateful, Mary, for your time and your efforts, and certainly any help you can kind of give us here in Kansas as we take a look at this topic, which isn't a massive issue in Kansas like you're seeing in California, but it's certainly something we need to consider addressing, and we want to make sure that it does not become a large problem. So welcome. You're welcome to take it from here.
Yeah, that is the point. If you do it wrong, then you will have a massive problem. And the one takeaway I hope you heard loud and clear over and over again. The difference between localities that are succeeding in reducing homelessness and those that are failing at reducing homelessness is that in those that are succeeding, it is not a one-size-fits-all thing. It's not coming out of one agency or one group. It's a collaboration across sectors. It's the business sector, the nonprofit sector, the public sector coming together and coordinating and being strategic and defining what success is going to look like, applying the tools that take you to that success, and measuring outcomes. Don't talk about outputs. All of these groups that are going to talk to you, many of these groups that are going to talk to you are going to talk about, we've distributed X number of meals, we conducted so many interviews, we provided this many beds, da, 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 da. But what are the outcomes in terms of human lives? And that's the only thing that you ought to be measuring. And the only success that I've seen anywhere is when people work together on this instead of in silos. So I urge you not to apply the black box of where the decisions are made either within an agency, either a nonprofit agency or in a public agency, imposing its idea of what the solution is.
Any questions at this time? Mary, I'll start them off. Can you talk a little bit more about just working across all sectors? That's something that we've heard several times in your video and several other places, but it sounds easy. It's probably not. People like their silos. For a lot of different reasons, but can you kind of just, what have you seen out there, and how do we make that happen? How do those people that have made it happen, how'd they do it?
There are a couple of locales that have done it successfully. One is San Antonio, and as you heard, it was the oil executive who reached out to the mayor whose election he had opposed, and the mayor, very to his credit, accepted the call and said, okay, great, you're the chair of the committee. And so they formed a committee from every sector in the city. So homelessness advocates, people from nonprofit agencies, people from public safety, people from the government. They spent 2 years visiting programs around the country to learn best practices. And then they crafted a strategic plan, which is the Haven for Hope model. The money for building the campus was raised privately. The city paid for the underlying land. So the entire project was $100 million. $60 million was the buildings. $40 million was the cost of land. And an ongoing basis. And then the really magic secret sauce was they're getting 184 nonprofits. By hook or by crook, they got them to come together and be a part of the Haven campus. And that is everything, because there is personalized care for anything anybody needs there. That took, I'm sure, some both carrot and stick doing, that if you will work with Haven, we will give you funding. If you do not work with Haven, we will not give you funding, from both the private sector and the public sector. The other city that's done this is Houston, and I heard when the governor's proposal for the $40 million grant was discussed the other day in the legislature, they cited Houston. But they were citing Houston as a housing first success model. Houston is not a housing first success model. Houston is a success model of a community working together. And in the coverage and speaking to the key players who were involved in implementing the system that they have there, the headline is, we started talking to each other. And you go on and it tells again about how all of the sectors came together, they met together, they coordinated their efforts, and that is how they're having success. We're working on this here in San Francisco. I've been for the past year having one-on-one meetings with different organizations. We had a convening in October, and we're working very hard to bring the disparate players together. It would be certainly helpful if we had a strong community leader to help us. Unfortunately, in San Francisco, we don't, so we're having to do it on sort of a grassroots basis. But people in the community want this problem to be solved. They're recognizing that the government's been promising, give us more money and we'll solve this for 40 years, and that they haven't. It's just gotten worse. We have more permanent supportive housing in San Francisco than anywhere in the country, and we have arguably one of the largest homelessness problems here. So that is not a solution.
Representative Howell.
Thank you, Chair. Thank you so much, Mary, being here to present to us today. I have personally taken on this, learning more about this issue of homelessness in particular in about the last 6 months of my life. And as I have studied different programs that seem to be successful to me, I observe the same thing that you're talking about with the collaboration. But I also have noticed that two other factors that seem to be important in being successful, and those are having peer employees or mentors, volunteers, people that have been homeless themselves, involved in the efforts to reach them. And then the other thing was collecting data and having all the data from all the different collaborating organizations, whether they're nonprofits or government entities, collecting the same information, reporting it to a central data point. And I'm just wondering, has that been something that you have observed or run across?
Absolutely, and that's what I was talking about, is identifying, defining success and identifying metrics that will let you know if you're achieving success, and measuring outcomes. So things like, improvement in employment, improvement in housing, improvement in substance abuse issues, and so on. That is absolutely key. And if you don't have a coordinated system, you cannot gather that kind of data. And you also want to be very careful, because a lot of studies are based on interviews. So there's a widely touted study that came out here in California last year, which purports to show some things that it can't possibly show. And it's based on interviews with people experiencing homelessness and addiction. And I'm sorry, but people who are interviewed tend to tell the interviewer what they think they want, what the interviewer wants to hear. So you can't do it on anecdotal evidence. It has to be on hard, as hard as data as you can get with human beings, but there are measurable outcomes that you can track, and that's what you need to be tracking.
Representative Carr.
Thank you, Mr. Chair, and thank you for the video and being here with us via WebEx. My question is in regard to the differences that may have presented themselves between the situation in San Francisco and the situation in San Antonio, as it speaks to the homeless population and the addiction. Would you say that those were comparable? Is the situation worse in San Francisco than the situation was in San Antonio, or what did that look like from the onset? And the reason I'm asking is, if you're running a race, if the end of the race is 100 yards away, it's probably going to be easier to get there than if the end of the race is 400 yards away. So my question is there a difference, or was there a difference in those situations?
So in 2010, when Haven opened, the numbers of people experiencing homelessness in San Francisco and San Antonio were virtually the same. In the 12 years since, the number of homeless in San Francisco has exploded by 80%. Downtown unsheltered homelessness in San Antonio is down by 77 to 80%, and countywide it's down 11 to 12%. You could also expand this to the country as a whole, because federal policy shifted to the Housing First model about that time. And overall across the country, homelessness increased by 12% in the subsequent years, while in San Antonio, again, downtown unsheltered homelessness went down by 77 to 80% and countywide down by 12%. So exact opposite outcomes. So at a time that the entire country was shifting to Housing First, which is again assuming that people are homeless because they don't have a house. So if you put them in housing, you've solved the problem, and putting all of the resources into getting people into housing, versus San Antonio took the opposite direction and put everybody into care. It's temporary housing where they get the care and then they can move on to permanent housing. Either mostly it's that they're able to support themselves. There is a small minority of people who will never be able to take care of themselves, and they do need to have subsidized housing provided to them, but it's a small minority. It's not where the resources should be directed. So that right there, to me, if anybody's paying attention and you see nationwide, everybody did it, the Housing First model, and homelessness went up everywhere. San Antonio did the opposite, and homelessness went down over the same period, dramatically down, statistically significantly down in the same period. I would think we'd want to draw some conclusions from that.
So I have a follow-up. So is that to say then that that the housing is not, and if housing is even the word that I should use here, but Haven for Hope, obviously they have facilities for those individuals to be housed. Or am I to assume that that's not subsidized by anything whatsoever?
It's a temporary situation. So it's like you're going to college and you're living in a dorm. That's not where you're going to live the rest of your life. So you go to Haven. There is a part of Haven that offers just low barrier shelter and they do have meals and showers and services are available. But that's where people who are continuing their substance abuse issues can get off the street and be safe overnight and so on. The larger part of Haven is what they call the transformational campus. And yes, it has housing, but it's akin to a dorm. You're living there while you're working through the problems and the issues that put you into homelessness in the first place. And then you can get yourself out of homelessness and you move on to your real home, which is not the Haven campus, and it's not permanent supportive housing. It's you're living your life at your full potential and you've been restored.
Thank you. I'll pause my questions at this time.
Representative Droege.
Thank you, Chairman. Thank you for this presentation. I think my question goes along with Representative Carr's somewhat. Is homeless in California the same as homeless in San Antonio? Is it the same demographic? Is it the same drug use level? I guess I imagine maybe with the porous border that we have, that there could be homeless involved there, and some of these people really want a home, and it might be different than somebody that decided to go to California because it was a beautiful place to go live out your dream of drug addiction, I guess. Is there any difference between the homeless in California and the homeless in San Antonio?
When Haven opened, it was about the same. I'll say this, that now homelessness in San Francisco is much more really dystopian thanks to fentanyl. And now we've got this thing called Tranq, this horse tranquilizer, which is very resistant to care and reversal. So by not handling it well 12 years ago, as San Antonio did, we now have a much bigger problem. However, the solution remains the same. We have to treat people as individuals, provide them with the appropriate service that addresses what put them into homelessness and addiction in the first place, if in fact they have an addiction, which probably 80% of people experiencing homelessness do. If they didn't have a substance abuse problem when they went into homelessness, life on the streets is so unpleasant that people self-medicate. So within a matter of weeks, most people experiencing homelessness do have a substance abuse problem because of that self-medication. I will say immigration does not fuel homelessness. Immigrants tend to find a place to live, even if it's 20 people in an apartment. Most of the people who are living in the streets are native-born Americans. They may not be Californians, quite a few of them are, but they're, for the most part, homegrown. Interestingly, we have California, San Francisco has a relatively small Black population. We have a relatively large Asian population, and among the homeless, we have almost no Asians, and we have quite a few Blacks. So there's obviously a contributing factor to family, stability of family, and so on. That is a large part of what puts people into homelessness is childhood trauma. And when you have communities that have higher degrees of childhood trauma and others that don't, you see it in your homelessness numbers.
Thank you. Very helpful.
And we do have a question from Representative Meyer, who's joining via WebEx. Representative Meyer.
Hi, thank you, Mr. Chair. Can you hear me okay?
Yes, we can.
Okay, thank you for being here today and giving this presentation. There are a couple things I do want to push back on, though, regarding some of the information you provided. I know you just said that about 80% of individuals experiencing homelessness are also facing substance use disorders. From what I have seen in our fact sheets that we've received from our statewide homeless coalition and UCS, which is United Community Services, who partners very closely with groups across the state. In fact, they meet once a month to address issues of homelessness and go over best practices, discuss outcomes and things like that. But what I'm seeing in the fact sheet that I have here is that in the state of Kansas, approximately 30% of people experiencing homelessness are struggling with substance use disorder, or SUD as we call it. So my concern would be that we're doing a lot of, stereotyping of individuals who experience homelessness, especially with some of the information given in the film. So I'd like to know if you could share with me where you got that 80% figure and point me in the direction of that citation, please.
If you're dealing with self-reported data, which 30% figures often are taken from self-reported information versus best guess by people who are working actively with people experiencing homelessness, is where the disparity often comes. And the higher figure comes from people who work with people experiencing homelessness. And again, it's not that addiction or substance abuse disorder is what has driven a lot of people into homelessness. Some of them it has, and it may be closer to that 30% figure. Again, once somebody is living in the street and it's a very scary and unpleasant and terrible situation, people will self-medicate. And unfortunately, that self-medication may well lead to substance use disorder.
So I appreciate your thoughts on that. So I know we haven't met before. The committee is very familiar with my work, but I just want to reiterate that I have done the work in the field. I am a social worker. I have worked with the homeless population for quite some time and also done data collection. This information is gathered from our annual point in time count. And I understand that you don't necessarily prefer the data collection methods, but they are reliable. And they are done on a yearly basis so that we can track the outcomes and the increases and decreases and different contributing factors to homelessness. So what my concern is that we continue to stereotype, and we're looking at, well, essentially, I just want to say, correlation doesn't equal causation, right? And that's the cardinal rule, especially when it comes to research. And I am very concerned that some of the presentation today has not pointed to deliberate data-based research that we have here in the state versus correlative and, stereotypical thoughts on who the homeless really are. While I do appreciate your presentation, I think that we really need to keep this directed towards Kansas as a whole.
And I appreciate that. The film was taken from a peer-reviewed policy report, which does draw on lots of data and many studies. The point-in-time count, I think everybody agrees is flawed, but it's the best thing we have. But again, it draws on interviews with people experiencing homelessness, and that's not always the best source of it. People don't always self-report to the best. The other point I try to make through over and over and over in the film is that this is an individual, very highly individualized situation, and we need highly individualized solutions. I do not think this is a one-size-fits-all thing. I do not think everybody who's experiencing homelessness is because they have a substance use disorder. There are many contributing factors, and that's why we do point to the Haven, because there are 184 service providers on the campus who can address almost every conceivable issue that a person is trying to, needs to address to overcome their homelessness and live a transformed life.
Thank you, Mary. We have several more questions, but just on that topic, I think during our interim committee in November, we did hear from different people around the state, and we did hear from business owners in Lawrence specifically talk about their experiences with the homeless and just some of the data they had about substance use disorders. And I think it does even vary, yes, from state to state, but even I think we've seen it in Kansas from some of our presentations. It may even vary from city to city. So, yeah, the data might be different from one city to the other, but I think everybody can agree that it's a significant number no matter where you're at. Representative Pickert.
Thank you, Mr. Chair. Thank you, Mary, for joining us. I have a question. Haven for Hope is obviously successful in dealing with homelessness. Have you found people who are homeless migrating to the San Antonio area because of the services, or is that mostly just people from San Antonio?
Well, when they first opened, they actually had other communities busing their homeless to San Antonio. So they had to implement a requirement, a 9-month residency requirement. People do cheat the system. Lamanda, who's one of the women I interviewed in the documentary, actually told me that she fudged her residency. So it happens, and that's fine. But yeah, the problem with having a solution is that everybody's like, oh, they've got it solved. Let's send our problem there. So it is something you need to deal with. We're on a quest is to get every community to work together and solve it at their own community in the way that's best in their community, with all the sectors involved, so that we don't have this thing where only Wichita is solving the problem. So everybody goes there for help, or only Lawrence is solving the problem, and so on.
Thank you. And also, is San Antonio strictly enforcing laws having to do with homelessness, like getting people off the street?
They're not really draconian about it, but however, I don't know if it was a short part of the video, but Haven is also a very important thing about Haven is it's extremely safe. And part of the process of building it was they interviewed extensively people experiencing homelessness to find out what they wanted. And the number one issue was safety. So they have a very strong security force on campus, and the campus itself is very secure. And among the people that they employ on campus are moonlighting San Antonio police officers. I interviewed a couple of them. And they, as they said on camera, by working there, they've learned how to interact with people who, may be having may have a mental illness problem or a substance use disorder problem. And by working there, they've learned compassion and they've learned how to talk to somebody who's agitated or might be having a bad day. So when they're back out in the streets and they come across somebody who's having a problem, they can talk them down. And Haven gives them a place where they can take somebody who needs help, drop them off, know that they're going to be cared for, and go back on patrol. And it gets them back to work. It gets the person taken care of. Haven also has a vast positive impact on the cost of public services such as police, fire, EMS, and others, that they're not having to deal with trying to take care of people in the street. They can take them to Haven.
Thanks a lot.
Representative Humphreys.
Thank you, Mr. Chair. Thank you, Mary, for bringing this and your Kansas and even Wichita roots. Appreciate that. I got the impression from something that you said when you, in your introduction, that maybe you had listened or heard about the effort in Wichita South Central. We had a get-together at lunch yesterday, the South Central delegation, about the $40 million that they're wanting to develop sort of a center, and I think they've visited the Haven of Hope in San Antonio. And my question is, have you seen those plans, and would you consider those sort of comparable to what they're doing in San Antonio, or would you say what they're doing is more of a housing first kind of solution?
I am not intimately familiar with it. I'm superficially familiar with it. My understanding of it is that it's a plan for a housing first model. And if that's accurate, look to California. You can spend millions and billions on housing first and your homelessness problem will grow.
Thank you. I appreciate that. Thank you.
Representative Wagner.
Thank you, Mr. Chairman. Thank you, Mary, for this presentation. I'm not a social worker or have that sort of background, but I have, you hear a lot of talk about, wraparound services, which I take it is just Haven for Hope, just very strong on wraparound services. Is that what you're saying is what makes a difference, or the fact that it is, because you have a campus where all these are located, it would make it extremely accessible to anybody who is in a homeless situation to access these services versus maybe a more scattershot approach, if you're literally, living under a bridge or down by the river. So could you address that question of wraparound services, and is that what you're saying makes the difference?
So there are reasons why people become homeless. And if you want to help somebody escape homelessness, you need to have them have access to the service that will address the underlying reason or reasons that they became homeless in the first place. Otherwise, you can put them in housing, but if their underlying issues are not solved, they'll either die in housing, which happens a lot in California, or they'll fall out of housing because they're not prepared to live alone or independently. Here in San Francisco, the model we're working on is a hub and spoke model. So rather than having a large campus, centralized campus such as Haven, there would be a central hub. And that's where people could come and get sort of triage to address their immediate issues, if they need sobriety, if they need detox, if they need mental health care, they need regular health care, whatever. They can get it there. There's going to be non-congregate housing they can stay in, but then it will connect to spokes, which are the care providers out in the community. So depending on what what program will best help an individual, they'll be connected into that one. So you don't have to do it in a large central campus. There are advantages to doing it that way because it's very efficient. Haven has also acted as an incubator for new service providers because it's a very low cost place for people to set up. They have a large building that people share, agents, service providers share. So not everybody has to have their own Xerox machine or their own building or their own, conference room or whatever. They pay Haven a CAM to be there, and it's very, very efficient. So there are good arguments for it. It's just in San Francisco, we don't have, 23 acres sitting in the middle of the city that we can access. So we're doing it this other way, which ideally working with experts on developing it, it seems as if it will have a very highly positive result.
My other question would be, is there some sort of like basic cost to a model, like a Haven Up for Hope or this not a housing first, but I mean, do you figure for every homeless person, you're going to end up having, $20,000 a year spent, or is it $50,000 a year? I mean, what is there some sort of, if someone was budgeting for this or looking at appropriating money, what type of dollar figure are you talking?
Well, again, the Haven model is very cost effective. They serve up to 1,700 people at a time, and their annual operating budget is something like $30 million, which is pretty much half and half public and private. Now, the nonprofits that are based there also have their own budgets and raise their own money for that. So that's not counted in the campus cost, but it's a very cost effective way of dealing with it. The way dealing with people in the street or and my biggest problem with housing first is appropriate for some people. It's appropriate for people who literally will not be able to improve their lives, and they're going to have to be supported forever. And if you make sure that it's decent housing and it does have care provided in addition to just the housing, great for that small minority of people for whom it's appropriate. But the term permanent supportive housing to me is just anathema to viewing human beings as creatures of a caring creator, or however you care to view human beings. The concept that somebody has to be permanently supportive, there's no possibility that their lives can be improved. Where they are now is where they're going to have to be for the rest of their lives. I just think is degrading and inhumane. So that's my moral objection to it, on top of the utilitarian reasons for objecting to it, because it doesn't work. And I may have forgotten what the question is, sorry.
Representative Roth.
Thanks for that video. That was really interesting. My comment is, as a homeowner, there's a tremendous amount of costs and upkeep involved in that. And I haven't understood the homeless, going to a home and having to take care of that. So I think I have to agree that with her, that all individuals have their own set of issues that we have to address, and we need a complete package to be able to do that. Otherwise, if we just put someone in a home, well, if they can only afford alcohol, tobacco, and drugs, how are they going to afford insurance, utilities, groceries, and stuff like that for their home and the upkeep of their home? And in the late 80s, I was in a management program about paradigms, and interestingly, it was the paradigm of, and they used a video of the homeless in Washington State, that their paradigm was just the next package of cigarettes, the next drug fix, the next bottle of alcohol. That was their paradigm, and that's what drove them. And so if that's driving them now, I think a whole care package for them is what we need to be looking at for that. Thanks for letting me speak.
Mary, any follow-up on that, or should we move to the next question?
Well, again, and it's not that we're providing the care, it's that we're providing resources that the individual can access and be their own solution. I think it was an important consideration in the attitude and the culture of Haven is that they don't ask people, what's wrong with you? How can we fix you? They find out their story, what happened to you? How did you get here? And then say, okay, here's some resources available. They the individuals themselves create the plan and work with the service providers. They'll say, what's your first barrier? Okay, here, let's work together to create a plan to overcome that barrier. Okay, come through that barrier. Okay, what's your next barrier? And your barrier to living to fulfilling your potential. And the person just works through things one after another. And that process is very empowering and it's very life affirming. And that's really what I'm begging for, is that communities allow individuals to have that affirmation of their lives and escape the horrible condition of living in the streets.
Okay. I've got a few questions for the end, but I think Representative Carr, you have a quick one? Yep.
So, Mayor, I don't know if you would have the answer to my actual question, but from what I gathered in the video, trauma played a very large part in those individuals that have now wound up being homeless. Trauma that dates back as far as childhood in many cases. I did hear you mention during the video on several occasions about the need for compassion. In fact, when I started noting it, I heard it at least 4 times beyond that. And never once did I hear in the video that there were services that had been or programs that had been altered or cut. There was, once you mentioned a request for additional funding. There was, again, no mention in the video about any funding that had been cut. And that message goes out to my fellow members of this committee. However, with that being said, would you know what the welfare reform laws were then in 2010 in San Antonio? I know here, in Kansas we have, and someone correct me if I'm wrong, we're currently under the HOPE Act. Is that correct as far as our welfare? What do we call that?
Are you asking specifically the question of, are there significant welfare restrictions in San Antonio?
San Antonio, so I'm trying to compare, if you would, what San Antonio had in place with respect to welfare reform in 2010 versus what Kansas has with respect to this welfare reform. And I understand that the presenter here may not have that information, so maybe that's something that I might ask of our research team, if we could compare the two.
If I may, could I attempt to rephrase the question?
You certainly may.
So, is there a connection between restrictions on welfare and an increase or decrease in homelessness?
I would say that was a fair question.
Okay. Mary, any comments on that?
I'll just say that California has extremely generous public assistance programs that people are eligible for after 30 days. So anybody who arrives here can immediately get on it, whether you have an address or not. and homelessness is spiraling. So, and frankly, welfare benefits, we've done a lot of data studies, and that's never been a data point that's come up, but maybe I haven't seen something. I certainly will look into the issue.
Thank you, Mary. So we're coming up to the 3 o'clock hour. There's a couple comments. The one that caught my ear was the spent 2 years going around the country to find best practices. So in San Antonio, more on a local level, and they had a businessman doing chairing that effort. I found that interesting. And rather than going to the state or to the government looking for money, he said, no, I actually want to go look for root causes for best practices. And it sounds like a lot of this is also kind of starts more on the community level. And I'm gonna guess throw an opinion, but ask your thoughts on this. So it sounds like the cities that look more for a long-term solution, they first look towards their local communities, their local businesses, the local people that are also already working on this topic. That's where they start first, because is it true that that's how they see this to actually be a long-term sustainable solution?
And also involve the people experiencing homelessness themselves and advocates. For homeless, we had the homelessness advocates, people from the public sector, people from the nonprofits. I mean, you want everybody to be involved, because everybody has a viewpoint, and the better you can strategize and coordinate efforts rather than people pursuing, all different pathways, the better you can leverage the brain power, the understanding. I mean, the biggest thing producing this film did for me was to help me really come to realize that there but for the grace of God go I. These people experiencing homelessness are individuals. A lot of them have really terrible stories about terrible childhoods, and I've thought, if I'd grown up like that, I'd be in the streets too. So it's very important to get all the viewpoints and expertise and understanding involved, so that you really can come up with a comprehensive solution that addresses the wide variety of individuals that are being impacted by homelessness.
Mary, there's several more questions, but we'll have to put a hold on them. I guess one final thing, Mary, would you mentioned that you are from Wichita, have Wichita roots. You want to spend just a few seconds talking about your Wichita roots?
Yeah, I grew up in Wichita, and much of my family is still there. I was there last week, a week before last, visiting one of my sisters. My dad was an entrepreneur, and my grandfather and dad started in the wheat business and then went into various and sundry other things. But the other thing is we were raised very much to believe in being contributors to our community. My parents and grandparents were very involved in the community, and that was instilled in us we don't sit back and delegate to the state government or the city government or anybody to solve our problems. We come together in community and we solve our problems together. And that also helps us, as I have learned through this documentary, understand that there isn't an us versus them. We're all basically the same. We have different circumstances, but we have the same hopes and dreams and motivations. And we can only understand that if we are working together on solving problems in our neighborhood, in our city, in our state together, and not giving it over to somebody else. Come give us the solution.
All right. Well, thanks again, Mary. Thanks for all your work on the topic, and certainly your very generous last hour and a half and all the time preparing for our meeting today. I personally have found it extremely helpful on many levels. So
I very much appreciate the opportunity. Anytime.
We might take you up on that and bring you back. All right. Thanks, Mary. Committee, we'll come back on Thursday. We have a hearing, and also we'll have a little presentation from research on that document on free and reduced lunch application verifications. So with that, we are adjourned. Thank you.